Bella.
Hi.
I'm Dr. Ivy B, and I'm going to be seeing you today. I was reading when you made the appointment, you mentioned that you had an allergic reaction. Can you tell me a little bit more about what happened?
I went out to eat and I ate something that I probably shouldn't have eaten, and I broke out into hives.
Okay. So, do you know what was in the food that you ate?
There was peanuts and chives.
Okay. Okay, and how soon after you ate you broke into hives? Was it instantly? Was it like 15 minutes, 20 minutes?
It grew over time, so instantly, but it became worse in 15 minutes.
Did you take anything for the symptoms? Benadryl, Zyrtec, something like that?
I took Benadryl.
Okay, did it help right away?
Yes.
Okay. Had this ever happened to you before?
No.
Okay. I also see here that you've been having some abdominal pain ever since. So is that like continuous all the time, or does it come and go?
It comes and goes.
Okay. Have you noticed any pattern, like gets worse after you eat, it gets worse like in the morning, or have you noticed any patterns?
When I drink coffee, that's when it hurts.
Okay. So I'm going to be doing just full physical assessment. I'll make sure that there's nothing on your abdomen that could be maybe caused by that allergic reaction or something completely separate, that it just was a coincidence that happened around the same time. And we're going to be doing an allergy test as well. We'll be testing for some of the most common allergens. Definitely we'll test peanuts because that's one of the most common allergies that people have. So we'll test for peanuts, and then we'll do a few others just to make sure. Sometimes there's cross-contamination in restaurants, so it could be something that you didn't know was in the food as well. Okay. I'm going to take your vital signs first. Okay. You can relax. Okay. That was 110/75. That was in the normal range. And I also want to listen to your heart and your lungs, make sure that there's no inflammation. Go ahead and give me a big inhale. Okay, give me a big inhale. Okay. I'll play this right here on your side. Give me a big inhale. Okay. Okay, your lungs sound clear. Sometimes when there's an allergic reaction, it can affect the respiratory system. Lungs are okay. Okay. Were the hives located mostly in one area? Was it just like all over the body?
It was on my face, in my back, and on my stomach as well.
Okay. So I do want to take a look at your skin. So I'm going to ask you to lay down so you're more comfortable. Okay, Bella, I'm just going to start taking a look at your skin. Okay, I'm going to be putting on my gloves. And then I'm going to start palpating and just making sure that there's no signs of the allergic reaction. That could be lingering. Okay, you can just go ahead and relax. Let's start with your face. You face me this way. Okay. So just notice any redness or swelling left. And palpate your lymph nodes. Actually, I can change my gloves. This one's a little bit big. Okay. Move on to your arms. Notice a little bit of keratosis pilaris on this area. A few scars. Now see, just turn your arm around like that. Just looking for any inflammation, making sure there's no lumps. Okay, nails look really healthy. Okay. I'll be using this tongue depressor. Just want to make sure there's no lumps. Okay, there's a little bit of tiny bumps in this area. Just taking a closer look. A little bit of scaly patches, and I would like to take a sample just of loose skin cells in this area. Then I'm just loosening up the scaly areas. So it does seem like keratosis pilaris, but I'm still going to send that to a lab. Make sure that we rule out any other skin conditions. Okay. Take a look at your other arm. Okay, I'm just going to take a look at your skin on this side. Make sure I don't miss anything. Okay, lymph nodes feel normal. Notice a tiny bit of irritation on your neck. It seems like it might be irritation from your necklace, actually. Do you wear this all the time?
I wear it often.
Yeah. Okay, there's some bumps in this area. Neck is normal. This is normal as well. Okay. Move on to your arm. Okay, nails look healthy, hands. Looks okay. A little bit of, again, the same pattern, small bumps. Looks like keratosis pilaris. Sorry. Just feeling for any inflammation. Okay, making sure that there's no bumps. I'm just passing the wooden stick. It helps me detect. So definitely a lot of little bumps in this area. Okay. It looks normal so far. I'm going to take a look at your abdomen before we continue with the allergy test, okay? I'm going to be lifting the gown a little bit. Is that okay?
That's okay.
Thank you. Okay. Okay, I'm just slightly palpating, making sure there's no bumps, lumps, any tender areas. If there's any pain at all as I'm pressing, let me know. Be listening. You can just breathe normally. Hear normal bowel sounds. Just gonna be percussing, so tapping lightly. Okay. Okay, I'm just gonna be palpating a little bit deeper. Just let me know if there's any pain as I'm doing this. Go ahead and take a deep breath for me. And exhale all the way. Liver seems normal size. There's a little bit of tenderness in this area. Okay, give me one more deep breath and exhale all the way. Okay, the bladder is normal size. Okay, I think you have a little bit of irritation of your intestines, but it might have been caused from sensitivity to what you ate. It should resolve itself in a couple of days. Okay. Okay, Bella, I'm gonna ask you now to go ahead and turn around facing down. I'm gonna be doing the allergy test on your back, and you can stay laying down so it's more comfortable, but I do need more access to your back, okay? So I'm gonna be opening the gown. Okay. Okay, I'm checking your back. I do see you have a few scars. So we're trying to stay away from that area. Right towards the bottom, like middle of your back. Seems to be pretty clear, so that'll be a better area to do the test. Just making sure there's no inflammation. Okay, everything seems normal. So I'm going to start by wiping off and making sure that we disinfect the test site. Okay, so today we're going to be doing a patch test. As opposed to the scratch test, we're just going to leave the substances on the surface. Okay. doing first the positive control. And the negative. And that will apply. Allergy number 1. 7. Number 9. Number 10. Number 10. Okay, we're going to be waiting a few minutes and let them make reaction. And then I'll come back and take a look at the test results. Okay, but I'm going to be removing the plastic film. Okay, I definitely see a couple allergic reactions. Got number 2, number 5, number 8, and number 10. And of course we have our positive control site. Okay, I'm going to be taking the measurements of the allergic reactions. 10 millimeters by 11. for number 2. Number 5, tiny bit smaller. Get 6 by 5. 15 by 9. Number 8, that's a little bit of rotation as well. Number 5 by number 5. Okay. Okay. Okay, everything else seems to be non-reactive. So that's great. Okay, Bella, I'm going to ask you to go ahead and sit back up on the bed. I'm going to discuss with you the results of the test. Okay, Bella, so based on the results from the allergy test, it does seem that you are allergic to peanuts. So that's probably the culprit for your allergic reaction. I did find that you have some sensitivity as well. Not as much, but definitely a little bit sensitive to shellfish and walnuts as well. Have you noticed that before? Sorry, do you consume a lot of walnuts or shellfish?
I don't.
No? Okay, so that's probably why you've never noticed. So yeah, I would just say to continue to avoid them. I will give you a prescription for an EpiPen if you ever do have a worse allergic reaction than what you had. You can go ahead and use the EpiPen. If it's just like you had this time, some hives, you can still breathe normally, everything else is okay, then I would just say take some Benadryl and see if that helps. And you should be able to manage. Just try to stay away from peanuts and shellfish and walnuts. Okay?
Okay.
Okay. And regarding your abdomen, I think it's just a little bit of inflammation, irritation from the allergic reaction, but that should be resolving itself in a few days. If it doesn't, definitely send me a message and I'll prescribe you something to help with it. And if not, we'll reassess and see what kind of treatment you would need. Okay.
Okay.
Okay. Well, that's it for me. Do you have any other questions for me?
No.
Okay. Well, it was very nice meeting you.
Thank you.